I'm Dr. Meena Chhabra. I'm a practicing physician and diabetes specialist from New Delhi. So today, a very interesting conference by Dr. Banshi Saboo in Ahmedabad, and my topic was individualizing care in the diabetic who's type 1 and very young, like children, then young adolescents, which is age 12 to 18, and then young adults, which is more than age 18. So this is what I try to emphasize, that if your child is younger than 12, the needs are different, a lot of parental care is required, the mother and father have to be involved, and you have to teach the child, empower the child to become independent. I spoke about insulin, how to take the injection, and I have a patient who's as young as 5 and can self-inject because we have empowered him. Then talk about diet, talk about exercise. But when it comes to the 12 to 18-year-old, we must change what we talk to the patient. We must involve the patient more often, less parental care, of course supervision by the parents, but more independence to the 12 to 18-year-old. There may be several issues here. There may be issues with alcohol, with, they may try some drugs. So all these have to be addressed. Then jobs, and young adults again, transitioning of care. So they may now be with the pediatric endocrinologist, and now they have to transition and reach the adult diabetologist or endocrinologist. And here we have to address different issues, education, jobs, and particularly if it's a girl with type 1 diabetes, they are very concerned about their marriage, whether they will have a normal pregnancy, whether the child will develop type 1 diabetes. So it's all about empowerment of the patient, and my model is called the 5P model. And these 5 Ps are: the patient has to be empowered by me, the physician, that's the second P. The third P is the parents, they have to be involved. The fourth P is the peer. The peer could be friends, could be another type 1 diabetic who's been following up with me for a longer duration of time and knows all the nitty-gritties of management of type 1. This could be a peer, the peer could be a sibling. So, and the fifth P is a psychologist who's actually going to talk about the trials and tribulations of managing type 1 diabetes, because it's a lot on the patient's plate. Blood sugar testing, then counting the carbs, eating at the right time, injecting insulin at least 4 times. So all these things can be talked about by the psychologist, and they can also address the patient, whether you have distress or are you scared about what will happen to you in the future. So this way we have, my talk actually explained how management of type 1 diabetes is different in the young child, in the adolescent, and in the young adult. And we should focus, but in all 3 age groups, the main thing is empowering the patient, teaching the patient to learn all these things. How to inject insulin, how to balance the meal with insulin, how to go out and yet take care of blood sugar, how to travel, and how to party yet take care of their type 1 diabetes. Thank you.